Madam, we are live. You can start the session.
So, good evening, friends. Welcome back to the Big Q in Big Q. So, this is Brain Teasers in association with OSM. So, this is the signature tune of.
आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर खोल पर खोल पर आठ
So, you all know that this is the third season of Big Q, which happens on alternate Wednesdays at 8 p.m. So, in this season, the platform is Kahoot for both the teams and the non-PG participants. There are total 15 episodes to be played, 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So these are our quiz masters for today's episode. Brain Teaser team is extremely thankful to the team of quiz masters who have toiled hard to create a wonderful experience of learning with fun. So for today's episode, we welcome Dr. Pooja Negi ma'am, Consultant Retina Unit at MNJ Western Regional Institute of Ophthalmology, Ahmedabad. Dr. Meenakshi Masih, Glaucoma and Anterior Segment Surgeon at Shri Balaji Institute of Medical Sciences, Raipur. Dr. Jitendra Vidhani, Consulting Eye Surgeon, Akshar Eye Hospital, Ahmedabad, and Class 1 Officer at Government of Gujarat. Dr. Aarti Heda, Consultant and Anterior Segment Surgeon based in Pune. And Dr. Bharat Mehta, Assistant Professor, NCR Institute of Medical Sciences, Meerut. So as we all know, that such a mega project is not possible without a strong financial support from the pharma company. So this was the promo from the Microvision team, who has been our steadfast partner since last 3 seasons. Our sincere most gratitude to Ashok sir, Mr. Kumaran and Mr. Navneet and all the field force of Microvision for all their support. We also thanks Mr. Sai and Numerotech team for the smooth and flawless execution of the quiz episode after episode in computing the results and other backend work which goes behind every episode. So now I will quickly familiarize you all with the format of the today's quiz. So as you all know, today is the 6th episode. So Kahoot platform for the students. First screen is the live quizzing, which will happen on the Zoom platform, while the second screen is the Kahoot to answer. Mentors to log in from the separate screen only on the Zoom platform. So total 10 sets will be there. Each set will contain 5 questions. You will get 10 seconds per question. There will be no negative marking. Fastest finger first will be the criteria. These are the prizes for the PGs in the finals. Mentors will also get the welcome gifts, and the winning team will get the 15,000 cash prize each mentor will get. And the audience prizes are per episode. So now let's play the sample question to check your login devices. So this is the sample question for you. Which hockey player is conferred the prestigious Padma Shri Award? Your options are option A, Harbinder Singh, option B, Bholanath Singh, option C, Padma Dilip Terke, and option D, Vivek Prasad. And your time starts now. So time is over. Let's see what's the answer. So the correct answer is Harbinder Singh. So with this, I welcome our first quiz master, Dr. Pooja Negi ma'am. She's a consultant at Retina Unit MNJ Western RIO Ahmedabad. She has a clinical experience of 15 years. She is co-investigator in various trials for wet AMD and diabetic macular edema. She has special interest in uveitis. She has co-authored chapter in Master's Guide to Manual SICS, and she is a student at heart with passion for teaching the mysteries of retina to junior residents and art of vitrectomy to senior residents. So with this, I hand over the screen to Pooja ma'am. Welcome, Pooja ma'am.
Thank you, Dr. Shilpi, and thank you, Team BQ, for giving me this opportunity. All the best to all participants. We start with the first question. Based on the OCT scan, give your spot diagnosis. Your options are A. Central retinal artery occlusion, B. Central retinal vein occlusion, C. Central serous retinopathy, and D. Full thickness macular hole. Your time starts now. And your correct answer is option A, central retinal artery occlusion. The classical picture of CRAO on OCT showing inner retinal layer hyperreflectivity, thickening of the retinal layers, and loss of inner retinal layer stratification. Coming on to question number 2. Name the selective mineralocorticoid receptor antagonist used for treatment of the chronic case of disease shown in the fundus fluorescein angiography. Your options are A. Spironolactone, B. Eplerenone, C. Rifampicin, and D. Acetazolamide. Your time starts now. And the correct answer is option B, eplerenone. This FFA is of CSCR. Eplerenone has increased mineralocorticoid receptor selectivity and affinity as compared to spironolactone, and so it has limited androgen-related side effects. It is used in the treatment of chronic CSR in the dosage of 25 to 50 milligram daily. It has side effects of hyperkalemia, hypotension, and hyponatremia. So you have to monitor RFTs, LFTs, and serum potassium levels. Next question. All are cardinal signs of acute inflammation in the body except A. Rubor, B. Calor, C. Fluor, and D. Dolor. Your time starts now. And the correct answer is C. Fluor. Fluor means increased secretion. The 5 cardinal signs of inflammation are first, rubor or redness, which occurs due to increased blood flow, tumor or swelling due to exudation of fluid, calor or heat, again due to increased blood flow, exudation of fluid and release of inflammatory mediators, dolor or pain due to stretching of pain receptors and nerves by the inflammatory exudates and chemical mediators, and functionalesia or loss of function, which may occur due to pain, disruption of tissue structure, fibroplasia, and metaplasia. Coming on to the next question. Retained copper foreign body can lead to the following, except your options are A. Sunflower cataract, B. Abnormal liver function tests, C. Retinal gliosis, and D. Suppurative endophthalmitis. Your options are, your time starts now. And the correct answer is B. Abnormal liver function tests. Wilson's disease or hepatolenticular degeneration is a rare autosomal recessive disorder caused by abnormal copper accumulation in the body, particularly the brain, liver, and cornea. The liver function tests will demonstrate liver dysfunction with abnormal values, whereas in intraocular foreign bodies containing copper, those with less than 70% copper are relatively inert. With less than 85% copper content, such as brass and bronze, it may lead to localized inflammatory response and are typically the cause of chalcosis. More than 85% copper content foreign bodies show a generalized pattern of intraocular copper deposition and more devastating outcomes such as suppurative endophthalmitis and phthisis bulbi. Coming on to the next question. According to Linkoff's rule, in inferior bullous detachments, the primary break is located A. Above the horizontal meridian, B. In inferior retina at 6 o'clock, C. Within 1 clock hour of 12 o'clock, and D. Below the horizontal meridian. Your time starts now. And the correct answer is A. Above the horizontal meridian. Linkoff's rule, as you can see in inferior bullous RD, the break is above the meridian with a thin strip of fluid. Linkoff's rule is for finding the break in primary rhegmatogenous retinal detachments. It says that if there are multiple breaks, the highest retinal hole is considered the primary hole. In supratemporal or supranasal detachments, the break is within 1.5 clock hours of the highest border. Rule 2 says in total detachment or superior detachments that cross the 12 o'clock meridian, the break is at 12 o'clock or in a triangle with the apex at the ora and the base at the equator, extending from 11 to 1 o'clock. In inferior detachment where both borders are equally high, the break is in the inferior retina at 6 o'clock. Rule 3, in inferior detachments, the higher side of the detachment indicates the side of the disc where the primary break lies and the break is found below the horizontal meridian. And rule 4, in inferior bullous detachments, the primary break is located above the horizontal meridian. It is my honor to introduce the next speaker, Dr. Meenakshi Masi. She is a glaucoma and anterior segment surgeon at Sri Balaji Institute of Medical Sciences, Raipur. She has done her MBBS from Indore and MS Ophthalmology from Gwalior. She has done her FACO Fellowship at Rajasai Institute and Glaucoma Fellowship from Arvind Eye Hospital, Tirunelveli. Over to you, Dr. Meenakshi.
Thanks a lot, Dr. Pooja ma'am. And I thanks the team BQ for giving me this opportunity. So the question starts now. The glaucoma medications associated with the decreased conjunctival goblet cell density are prostaglandin analogs, B. Selective beta blockers, C. Non-selective beta blockers, and D. Alpha agonist. And your time starts now. And the correct answer is option C, that is non-selective beta blockers. The non-cardioselective beta blockers such as timolol and evopinolol have been associated with decreased conjunctival goblet cell density, and corneal sensitivity may be decreased with these agents. And topical beta blockers with intrinsic sympathomimetic agents such as cartilol have fewer systemic side effects. less effect on corneal sensitivity, and decreased tinging and red eye, and better local tolerability. The second question is, look at the picture and say what is the most likely diagnosis. Option A is tractional retinal detachment. Option B is tigroid fundus. C is epiretinal membrane. And D is thyroid-related ophthalmopathy. And your time starts now. And the correct answer is option D, thyroid-related ophthalmopathy. The fundus image depicts chorioretinal folds, and it can be caused by globe compression from the enlarged extraocular muscles of thyroid ophthalmopathy. Question number 3 is, causes of aqueous tear deficiency include all of the following, except option A, Relay Day syndrome, option B, antihydrotic ectodermal dysplasia, option C, Shire-Drager syndrome, and option D, Fraser syndrome. And your time starts now. The answer to this question is Fraser syndrome. In Fraser syndrome, it is not associated with ATD, but rather it includes cryptophthalmos and renal agenesis and anal atresia. The next question is, which of the following is not a prognostic significance in choroidal melanoma? A, presence of retinal detachment, size of the tumor, C, cytology of the tumor cells, and D, presence of extraocular extension. And your time starts now. Answer is presence of retinal detachment. The prognostic factors in choroidal melanoma are extent of metastatic disease, age, size of intraocular tumor, extent of extrascleral tumor extension, ciliary body involvement, and histopathological and cytogenic features. Look at the photograph. What does the photograph depicts? A, punctal occluded by an intracanalicular collagen plug, punctum occluded by a silicon punctal plug, punctum occluded by a punctal cautery, and punctum occluded by an extruding Jones tube. Your time starts now. The answer is option B, punctum occluded by a silicon punctal plug. The picture depicts a punctum occluded by a permanent silicon plug with a colarity to keep it in place at the punctal opening. So now I would like to introduce Dr. Jitendra Vidhani, our next quiz master. He's a consulting eye surgeon at Akshar Eye Hospital and Class 1 officer in Government of Gujarat. He did his MBBS from Sumandeep Vidyapeeth, Barodara, and DOMS from K.J. Somaiya Medical College, Mumbai. He has done his short-term fellowship in SICS and in phacoemulsification from BPA, and long-term fellowship from BPA School of Optometry, and short-term fellowships in advanced cataract surgery at Nandadeep Eye Hospital. His interests are reading, training and mentoring the youth, charity work among vulnerable groups, and music. Welcome, Dr. Jitendra.
So thank you for the introduction, man. And I would like to take this opportunity to thank the team, the Big Q. So good evening, everyone, and all the very best. Let's begin. All of the following statements are true about Richard keratometer except A, one position keratometry, B, fixed object size, C, doubling device distance, D, fixed image size. Your time starts now. So the correct answer is D, fixed image size. So this is the explanation. It's a Bosch and Lomb keratometer, one position keratometer. The principle is constant object size and variable image size, fixed doubling distance. We're moving on to the next question. What is the type of tonometer shown here? A, Pascal's DCT. B, Goldman's tonometer. C, Schwartz tonometer. Or D, NCT. Your time starts now. So the correct answer is A, Pascal's DCT. This is the explanation. The Pascal dynamic contour tonometer is a third generation digital contact tonometer. It measures pulsatile IOP directly and continuously. Direct measurement of the pressure eliminates systematic errors from force to pressure conversion. Numerical display of result on LCD screen avoids operator bias and reading errors. Unlike the applanation tonometers, which are influenced by corneal thickness and other characteristics of the cornea, they may produce misleading estimates of the IOP. The Pascal provides an accurate direct measurement of true IOP, which is independent of inter-individual variations in corneal properties and biomechanics. The IOP measurement is rather accurate, even on post-LASIK and keratoconic eyes. Moving on to the next question. What does this image indicate? A, cotton cheese appearance. B, breadcrumb appearance. C, Hofer's sign. Or D, sunset sign. Your time starts now. So the correct answer is C, Hofer's sign. This is the explanation. Hofer's sign, that is pseudo-exfoliation, which causes secondary glaucoma, and it is also the most common type of secondary glaucoma. Moving on to the next question. Pick the odd one out. So you have to pick one odd image out, and your time starts now. And the correct answer is B. All the others were dermolipoma. The dermolipoma is one of fat-containing epibulbar mass lesions of lateral canthal area beneath the temporal or subtemporal bulbar conjunctiva. This should be differentiated from subconjunctival fat prolapse, as they have different radiological features and treatment strategies. Moving on to the next question. What is the type of hypersensitivity reaction shown in this figure? Type 1, type 2, type 3, or is it type 4? Your time starts now. And the correct answer is type 1, A. The explanation is it is type 1 hypersensitivity reaction, which is seen in VKC, and the appearance is called as cobblestone appearance. So I would like to take this opportunity and introduce our next quiz master, who is a very young and talented surgeon from the land of Chhatrapati Shivaji Maharaj, that is Maharashtra, Dr. Aarti Heda. She's a consultant anterior segment surgeon based in Pune. She's done her DNB and FRCS, and she has various other degrees and allocates to her name. She's associate editor of Global Journal of Cataract Surgery and Research in Ophthalmology since 2021. Part of the core team of medical legal cell of Young Ophthalmologists Society of India since August 2022. National and international coordinator for International Society of Manual Small Incision and Cataract Surgeons. And her area of interests are cataract, glaucoma, cornea, and refractive surgery, medical legal aspects in ophthalmology and research. So welcome, ma'am.
Thank you so much, Dr. Jitendra. So at the outset, I would like to thank Prashant Bavankule sir and Dr. Shilpi for all the efforts. And I would like to thank all my co-quiz masters as well for making this session very interesting. So without further delay here, let's go on with our next question. So chromosome affected in sutural congenital cataract is, your options are 17q11, 11p13, 13q14, and 16q22. And your time starts now. So let's see the answer. The answer is 17q11. Moving on to our next question. An intraocular lens is placed accidentally in the sulcus instead of capsular bag. Can lead to which of the following? Your options are with the rule astigmatism, irregular astigmatism, myopic shift, and hyperopic shift. And your time starts now. Let's see the answer. The answer for this question is myopic shift. Moving on to next question. This is the finding in a 26-year-old female. Vision is 6/6 in both the eyes. Which of the following medication is most likely to cause this? Your options are furosemide, minocycline, topiramate, and acetazolamide. And your time starts now. Let's look in the correct answer. The correct answer is minocycline. Moving on to next question. What is the diagnosis for this case? The clue I give you is other eye has the same finding, and your options are subconjunctival worm, cyst, thread under the conjunctiva, and conjunctival lymphangiectasias. And your time starts now. Let's look into the answer. The answer is conjunctival lymphangiectasias. Moving on to next question. What is your diagnosis? The options are eyelid hemangioma, orbital lymphangioma, retinoblastoma, and microphthalmia with orbital cyst. And your time starts now. The correct answer is microphthalmia with orbital cyst. So with this, I would like to introduce the next quiz master, who is Dr. Bharat Mehta. He has done his MBBS for Vardhaman Mahavir Medical College and Safdarjung Hospital in New Delhi, followed by his MS in ophthalmology and senior residency in New Delhi. He has also done a short-term training in phacoemulsification from Sadguru Netra Chikitsalaya. He is currently the assistant professor at NCR Institute of Medical Sciences in Meerut. He has lot many extracurricular interests as well, like creating, writing, dancing, dramatics, and table tennis. He has also won prizes for dance performances at various events, to name a few: Cultural Evening at iFocus 2016. So with this, over to you, Dr. Bharat.
Because of some reason, Dr. Bharat Mehta is not able to join today. So I'll play his quiz on his behalf. So this is a section 5. The first question is, what do these two pictures have in common? Your options are A, appearance, B, etiology, C, lab investigations, and D, name of the inventor. And your time starts now. So now let's see what is the correct answer. So the answer is A, appearance. So this is a picture of birdshot chorioretinopathy, which was first described in 1949. In 1980, two eye specialists named it birdshot chorioretinopathy for its unique cream and orange oval-shaped spots scattered throughout the retina. These spots resemble the pattern from the birdshot small shotgun pellets. So the next question is, what is the common link between these two images? Your options are country of origin, causative organism, discovering the scientist, and none of the above. Your time starts now. Now, the correct answer is option B, that is causative organism. So this was botulism, which was first recorded in Europe in 1735, and it was suspected of being associated with German sausage. It was named after the Latin word for sausage, that is botulus. So the third question is, which of the following is pathognomic of Oguchi's disease? Option A, early dark adaptation with normal light adaptation. Option B, early dark adaptation with delayed light adaptation. Option C, delayed dark adaptation with normal light adaptation. And option D, delayed dark adaptation with delayed light adaptation. And your time starts now. So let's see what is the answer. So the correct answer is delayed dark adaptation with normal light adaptation. So Oguchi's disease is autosomal recessive form of congenital stationary night blindness. It is caused by disruption in the steps of inactivation of rod phototransduction because of mutations either in the rhodopsin kinase gene or arrest in the gene. Patients complain of static nyctalopia since childhood, and there is preservation of vision in the bright light. Let's move to the next question. The 5.4 question is, how can we diagnose Brown syndrome? Your options are A, force duction test, B, force generation test, C, force degeneration test, and D, none of the above. Your time starts now. So let's see what is the correct answer. So the correct answer is forced duction test. So Brown syndrome, also called as superior oblique tendon sheath syndrome, that is vertical strabismus syndrome. It is characterized by limited elevation of eye in adducted position. The most common cause is secondary to the mechanical restriction of the superior oblique tendon or the trochlear complex. It is diagnosed on the basis of the 9-gaze pattern, which can be confused for an inferior oblique palsy. And the differentiating test is forced duction test. Now let's move on to the last question of this set. That is, which of the following statements is true? Your options are PMA IOL cannot be implanted in sulcus. Option B, AC IOL can only be angle supported. Option C, 4-point fixation is must for scleral fixated IOLs. And option D, foldable acrylic IOL should not be implanted in the sulcus. And your time starts now. Let's see what is the correct answer. Answer is D. That is, foldable acrylic IOL should not be implanted in sulcus. Implantation of a foldable IOL in the ciliary sulcus can cause iris irritation, pupillary block, and shifting of the IOL. So with this, we are through with the first set of our questions. So now it is time for the commercial break. So it's time to declare the winners of the last episode, that is episode 5. So congratulations to all the winners. So this is the list of the episode winners from the PG category and the private practitioners. I request all of you to please send the message in the question and answer box so that we can let you in at the end of the episode to have a chat with you. So with this, we move on to the next section. I again hand over the screen to Dr. Pooja ma'am.
Thank you, Dr. Shilpi. We start with the first question. Sulfur hexafluoride gas used for pneumatic retinopathy lasts for how many days? Your options are A 12 hours, B 12 weeks, C 38 days, and D 12 days. Your time starts now. And the correct answer is D 12 days. The following gases are used in pneumatic retinopathy. Air, which is used in a 0.8 ml dose, it is non-expansive and lasts for 4 days. Sulfur hexafluoride is used in 0.5 ml dose. It doubles by 36 hours and lasts for 12 days. And C3F8 in a dosage of 0.3 ml, which quadruples in 3 days and lasts for 38 days. Coming on to the next question. Most common cause of chorioretinitis worldwide is, your options are A. Tuberculosis, B. Toxocariasis, C. Toxoplasmosis, and D. Syphilis. Your time starts now. And the correct answer is C. Toxoplasmosis. Toxoplasma chorioretinitis is the most common cause of posterior uveitis worldwide. The hallmark findings are focal area of intense necrotizing retinochoroiditis with moderate to severe overlying vitreous inflammation leading to the headlight in the fog appearance. It is a recurring disease, so you see an adjacent or nearby retinochoroidal scar. Treatment is with sulfadiazine and pyrimethamine and prednisolone along with folinic acid with regular monitoring of blood cell counts. The addition of clindamycin results in the so-called quadruple therapy. Next question. Field study studied the role of which drug in diabetic retinopathy? Your options are A. Atorvastatin, B. Fenofibrate, C. Simvastatin, and D. None of the above. Your time starts now. And the correct answer is B. Fenofibrate. This study studied the effect of fenofibrate on the need for laser treatment for diabetic retinopathy. It found that treatment with fenofibrate in individuals with type 2 diabetes mellitus reduces the need for laser treatment for diabetic retinopathy, but the mechanism of this effect does not seem to be related to plasma concentration of lipids. Next question. Seeing the fundus picture, grade the disc edema. Your options are A grade 2, B grade 3, C grade 4, and D grade 5. Your time starts now. And the correct answer is D grade 5. The grading of papilloedema, grade 1, is a grayish C-shaped halo surrounding the disc with sparing of the temporal disc margin and radial nerve fiber layer striation disruption. In grade 2, the halo becomes circumferential. The nasal border is elevated, but we can still see the major vessels. In grade 3, there is obscuration of at least one vessel leaving the disc. Obscuration of a major vessel on the disc, complete elevation including the cup, and circumferential halo. Grade 5 is obscuration of all vessels on the disc and leaving the disc plus all features of grade 4. Coming on to the next question. Spot the diagnosis based on the ultrasound picture. Your options are A. Optic nerve glioma, B. Choroidal coloboma, C. Choroidal osteoma, and D. Thysis bulbi. Your time starts now. And the correct answer is C, choroidal osteoma. Osteoma is a benign ossifying tumor characterized by mature bone replacing choroid. So on ultrasound, the A scan shows a high intensity echo spike and the B scan shows slightly elevated, highly reflective choroidal mass with acoustic shadowing, which gives an appearance of pseudo-optic nerve. The mass persists and lower scanning sensitivity after the other soft tissue echoes have disappeared. Thank you.
Meenakshi ma'am.
Yeah. Hello again. So look at the picture, and the most appropriate test to obtain for this patient is, and the options are A, blood pressure measurement, ANA, option C is chest X-ray, and option D is CD4 count. And the time starts now. And the correct answer is D, CD4 count. The patient has CMV retinitis, which is found in immunocompromised individuals. The next question is, which of the following is not a potential complication after cataract surgery with implantation of a multifocal IOL? The options are Irwin-Gass syndrome, B, Z syndrome, C, halos, and D, decreased contrast sensitivity. And the time starts now. Answer is B, Z syndrome. Z syndrome refers to a complication of the crystal lens in which the plate haptics are bent asymmetrically, so the lens has a Z configuration. The next question is, the Malugin ring is least helpful in which of the following cases? Options are A, chronic pilocarpine treatment, B, pseudoexfoliation syndrome, C, intraoperative floppy iris syndrome, and D, ectopia lentis. And your time starts now. Answer is D, ectopia lentis. Malugin ring device is to enlarge a small pupil and to stabilize an atonic iris. This may be necessary in patients with pilocarpine treatments, pseudoexfoliation, and IFS. But pupillary dilatation is usually not an issue in the ectopia lentis. The next question is, look at the picture. Which of the following is not a risk factor for the condition shown in the photograph? Option A is pseudoexfoliation syndrome, B is silicone IOL, C is small capsular excess, and D is anterior subcapsular cataract. And the time starts now. The correct answer is D, anterior subcapsular cataract. The explanation is this patient has capsular phimosis or anterior capsular contraction syndrome, which is not associated with anterior subcapsular cataract. The next question, which of the following helps to differentiate between orbital infection and inflammation? Options are A, proptosis, B, pain with eye movements, C, presence of sinus disease, and D, erythema. And your time starts now. And the correct answer is C, presence of sinus disease. Proptosis, pain with eye movements, sudden onset, and erythema are characteristic of both orbital infection and inflammation. The most common cause of orbital cellulitis or infection is adjacent sinus disease.
Dr. Jitendra.
Yeah, so good evening again, and all the best to all the participants. Let's begin. What is the prevalence of ocular lesions in juvenile xanthogranuloma? Is it A, 30%, B, 40%, C, 80%, or D, 10%? Your time starts now. So the correct answer is D, 10%. In a cohort study of 30 patients with ocular juvenile xanthogranuloma, the mean age at diagnosis was 4.3 years. The median was 1.3 years, and 0.3% to 10% of patients with cutaneous JXG were reported to have ocular involvement, with children under 2 years being at increased risk. So the answer was 10%. Moving on to the next question. Which disease is this sign seen in? A, Stargardt's disease, B, diabetic retinopathy, C, hypertensive retinopathy, or D, TB choroiditis. Your time starts now. So the correct answer is A, Stargardt's disease. This was the dark silent choroid that is seen in Stargardt's disease. So next question. All are the features of this machine except A, 6 marker points, B, dual zone keratometer, C, latest update, Hale RBF, Barrett Universal 2, Barrett 2K, or D, has dense cataract measurement mode. The time starts now. So the correct answer is A, 6 marker points. So the machine is a Lenstar biometer. It has automatic positioning system for dynamic eye tracking. 9 parameters captured in one shot. Dual zone K keratometer, and T-cone topography allows true Placido topography of central cornea, 32 measured points. It is integrated with iSuite IOL, inbuilt premium IOL calculation for cataract surgery and post-refractive surgery. So whenever we are opting for a premium IOL surgery, this is a very helpful machine for that. And it has a latest update with Hill RBF, Barrett Universal 2, and Barrett 2K formulas as well. So the next question. Identify the incorrect statement regarding the following image. A, measures optical axial length. B, uses high frequency sound waves. C, it has an accuracy of 0.12 millimeters. Or D, measures from corneal epithelium to RPE. The time starts now. So the correct answer is option C, accuracy 0.12 millimeters, and we'll see the explanation. So this was an optical biometer, IL Master. It measures optical axial length, measures from corneal epithelium to RPE, and it has an accuracy of 0.012 millimeters. Next question. From where primary vitreoretinal lymphoma arises? Option A, CNS. Option B, testis. Option C, nose. Or option D, ovary. And your time starts now. So the correct answer is option A, CNS. So primary vitreoretinal lymphoma is a rare form of primary central nervous system lymphoma arising in the intraocular compartment without the brain involvement. Despite its apparent indolent clinical course, PVRL can cause permanent vision loss and CNS relapse. the major cause of death in patients with PVRL. The pathophysiology is unknown, and as in PCNSL, the transformation of tumor cell likely originates outside the CNS before the cell migrates to the eye and proliferate within an permissive microenvironment. Moving on to the next question.
Dr. Arati.
Yeah. So let's move on to the next set of question. And here we start. A 45-year-old male patient was using some FDA-approved eye drops for seeing near vision clearer. Now he is diagnosed with rhegmatogenous retinal detachment. Which of the following topical drops may be implicated? And your options are pilocarpine 1%, pilocarpine 1.25%, pilocarpine 2%, and pilocarpine 1.5%. And your time starts now. Let's see the correct answer. The option B is correct, pilocarpine 1.25%. Moving on to the next question. Diagnose the CT image, and your options are maxillary sinus polyp, intraocular foreign body invading maxillary sinus, orbital floor fracture, and orbital varix. And your time starts now. Moving on to the answer. The correct answer is orbital floor fracture. Let's go to the next question. In BETT classification, Birmingham is located in which country? And your options are UK, USA, France, and Germany. And your time starts now. Let's see the correct answer. The correct answer is USA. So I'm sure most of you would have got this correct. Moving on to the next question. Which is the most common site for an ocular malignant melanoma? And your options are conjunctiva, iris, ciliary body, and choroid. And your time starts now. Let's see the answer. The correct answer is choroid. Moving on to the last question for this set, which is false regarding primary acquired melanosis of the conjunctiva. Your options are pigmented lesions represent proliferation of intraepithelial melanocytes. It is primarily a disorder of middle-aged and elderly. Most concerning indicator of potential malignant transformation is nodular thickening. And most frequently involved region is palpebral conjunctiva. And your time starts now. And the correct answer is option D. Most frequently involved region is the palpebral conjunctiva. With this, over to you, Dr. Shilpi.
Yes. So this is the last set of today's episode. So 5 questions to go. So the first question in this set is, which of the following is not an MIGS? A. Ab interno canaloplasty. B. Eye stent. C. ADI. And D is Zen implant. Your time starts now. So let's see what is the correct answer. It's C. ADI. So it is a non-valved glaucoma drainage device and it is not minimally invasive glaucoma surgery. So moving on to the next question. A person with visual acuity of 2 by 60 in the better eye would be considered to have. Your options are option A, legal blindness, B, social blindness, C, manifest blindness, or D, absolute blindness. And your time starts now. So let's see what is the answer. The answer is social blindness. So this is the chart, and there is a comparison between the WHO and the NPCB definitions according to the vision, whether it comes under the low vision or the blindness category. So moving on to the next question. Recurrent corneal erosions are not seen in which of the following corneal dystrophy? And your options are A, EBMD, B, PPCD, C, Rees-Buckler dystrophy, and D, Thiel-Behnke dystrophy. Your time starts now. Let's see what is the answer. So the correct answer is option B, that is PPCD. So PPCD is posterior polymorphous corneal dystrophy, which is a variant of endothelial dystrophy. Recurrent corneal erosions are not seen in this dystrophy. Moving on to the second last question of today's quiz. This historic lens was named after which satellite? Options are A, Apollo, B, Sputnik, C, Chandrayaan, and option D, Rapid Eye. Your time starts now. So the correct answer is option B. So this famous intraocular lens was invented in 1968, and it is an iris supported ACIOL with 6 points of support. So now the last question is, what is the use of the Theramon device? Your options are A, occlusion therapy, B, tumor ablation, C, IOFB removal, and D, surface ablation surgery. Your time starts now. So the correct answer is option A, occlusion therapy. It is used in occlusion therapy. So this is used in eye patching to monitor the compliance in the children, and it uses infrared thermal sensing to record eye movements. So with this, we are through with the today's quiz. So I again thank all the quiz masters for today's episode. Sai,
Madam, can you share the winners slide of last week again?
okay, okay, wait.
So I request all the participants who were amongst the winners for the last episode, request them to join us. Oh, we also have lot many mentors with us today. Vijayvarshini, Dr. Purvasha, Dr. Rajesh. You can come live now. Sai, any of the any one of them have joined us? Any
One already joined. Dr. Subiksha has joined.
Okay, Dr. Subiksha.
Sorry,
Can-
sir, I wanted to be there as a quiz master today, but I have been stuck in Delhi traffic for the past 3 hours.
Yeah, Dr. Bharat, we definitely miss you a lot. You made so much of efforts, but couldn't be there live on the screen. That's unfortunate. Okay, Dr. Subiksha. Yeah, you are muted. Yeah.
Good evening, sir.
Yeah, so congratulations, I should say.
Thank
And
you, sir.
maybe, just tell the both of your names. And what is that?
So that's my pet, sir. My cocktail, sir.
Get it ahead, yeah. Bring him into the camera. We would like to see him. What do you call him?
Tweety, sir.
Huh?
Tweety, sir.
Preeti?
Tweety, sir.
Tweety. Oh, so how do you manage with it in your you stay in a hostel?
No, sir. I'm a day scholar, sir.
Okay. That's what I was wondering. Who takes care of your pet when you are going to college and all? Good. Very well played, and keep playing. We would like you to win more prizes, and you
Thank
should
you,
win
sir.
the final. Huh? Best of luck. Where are you? Just introduce yourself in details.
We are from Coimbatore Medical College, sir. We're final year PGs. This is Dr. Vinodini. I'm Subiksha. Our mentor is Dr. Jeeva Kalam.
Okay. Congratulations, and do congratulate your mentor as well. Keep
Thank
playing.
you, sir.
We'd love to see you to the quarterfinals and semifinals. Okay.
Yes,
And
sir.
your tweety has already tweeted.
Yes,
Yes,
sir.
he said. We have Dr. Ruhel Chaco. Yes, can you unmute yourself?
Yes, sir.
Dr. Ruhel, Dr. Chaco,
Hey,
just introduce yourself.
I'm from Arvind Eye Hospital, Coimbatore, and my teammate is Anusha.
Okay.
We came, I think, 10th on that list.
Okay, where is she but?
She's not playing with me today.
Why? Had a fight?
I'm doing it alone.
Okay, good.
Our mentor is Dr. DC, sir.
Okay. Chandrasekhar, sir.
Yeah, yes.
Oh, good. You're lucky to have such a great mentor. Congratulate him on my behalf.
Thank you.
Jitendra, you can quiz in such you can have an informal chat. Aarti, you can join us for a informal chat as well. Dr. Maushmi, yeah.
When you said Dr. DC, I just remembered my residency days when Dr. DC used to take class in Eye Foundation and we used to go there. So he's really lucky to be his student, I should say that.
Yeah. He's very passionate about quizzing and
Yeah.
teaching. I think it's more than that. Good. Congratulations, Dr. Chaco, and keep playing. We were last year, you remember the Arvind team made it into finals. So we are looking forward. We have much more expectations from you besides scoring on this.
Thank you, sir.
Okay. Dr. Maushmi, can you get your video on? Dr. Maushmi, Dr. Shruti.
Hi, sir.
So you were placed at which position? What was your team name?
No, sir. I was in the private practitioner group.
अरे यार
So-
तुम अभी भी तो रेसिडेंट दिख रही हो.
नहीं, sir. PP
हाँ?
में है.
Okay, good. No, you look like a resident. That's what I said. So
Okay.
just introduce yourself.
Sir, I'm currently working as an assistant professor in Maharaj Agrasen Medical College, Agroha. I just passed my senior residency in May from RP Center. AIIMS.
Oh, good. Maushmi, you were with one of our previous quizzes
No, sir. No.
last
No.
season? No.
No, sir.
Okay.
Sir, I met you, I think, when you came for Sirsa AIOS conference at that time. We had
Your specialty. Your
retina.
Oh, you're our retina girl. Good.
Yes.
Retina people are always smart. What say, Jitendra? क्या कहते हो?
सर आपने बोल दिया अभी फाइनल अभी क्या बोलें
Good. So, Shruti Nair, can you get your video on?
Hello, sir. Good evening.
So, where are you from? Just introduce yourself.
So I'm Shruti. I'm a final year resident, and
I'm Fatima, final year resident.
we're
from
from
Zip.
Jipmo, Pondicherry.
Okay, Kasturi madam and all, you people always are there in the finals. Okay, good, good. Well played. And who is your mentor this time?
Nirupama ma'am itself,
Oh,
Kasturi.
Nirupama madam. Congratulate her. And keep playing. We have a season to first season. Your Jipma team was into finals. So we are
Yes,
looking
sir.
having much more expectations from you as well. Besides winning this, good. Okay, this episode. Congratulations.
Thank you, sir.
Okay. And Dr. Wasavi, can we have you with us? Get your video on.
Good
Yeah.
evening, sir.
Do introduce yourself.
I'm Dr. Vaski, sir. I'm from Andhra Medical College, Vishakhapatnam.
So you were into PG, PP, private
PG.
PG category. Okay, okay. So where is your partner?
So she's having duty today, so she couldn't join.
Very well. So today's episode you played all alone?
Yes,
Oh, good, good. Very good. Keep playing. And who is your mentor?
Dr. Vishwamitra, ma'am, sir.
Very good. Do congratulate her and ask her to be present and do join us. They can join us on the Zoom platform henceforth episodes. Okay.
Thank you.
Well played.
Sir,
Congratulations.
PG from South India is stealing the show, I feel.
Yeah, yeah, yeah. These people only work, they study and study, unlike us people from North,
Sir, I am from South, sir. I've done my residency and fellowship from South, so I'll call myself South
But
Indian
but
right
now
now.
you're in West. Now you're in
No,
West.
no, no.
So
Right now I'll call because they are winning, na, so I'll go to the winning team.
this is not done, sir.
Even I have done my fellowships and all from South Madurai and Shankar Netralaya as well. I do accept, but after looking at them, yeah, we people are less committed compared to the people born and brought up there. There is no second thought. Okay, Ashwati, Vijayan, Lekha, do join us. Get your video on.
Good evening, sir.
Do introduce yourself. Come on.
Sir, I'm Dr. Ashwati, and this is my partner, Dr. Aparna. We are from Kottayam Medical College.
Oh, good, good, good. Congratulations. And your mentor?
Dr. Padmasree, sir.
Okay. Very well played. And keep playing. We would love to see you in the quarterfinals as well. Quarterfinals and the semifinals and the finals eventually. Okay?
Thank you, sir.
Best of
Thank
luck.
you, sir. Thank
Do
you,
well.
sir.
Okay. And Lekha, you're muted, dear.
Now,
Yeah. Yes.
good evening, sir. Sir, I was the winner in the private practitioner category. I have finished my post graduation from RP Center just in December. So currently waiting for senior residency.
Okay, okay, okay. ठीक है. Very well played. So, अभी कौन सी इसमें सीनियर रेसिडेंसी लोगी? कौन सी स्पेशलिटी में you would like to work
Sir,
as a
I'm going to join MCH in PGI Chandigarh, cardiac cataract and refractive surgery.
रेटिना से नहीं इन्फ्लुएंस हुए? इतना बड़ा क्विज मास्टर सामने बैठा है. डॉक्टर शिल्पी वाज विथ यू. शी इज अगेन ए वीआर सर्जन. Jitendra, you people couldn't influence her?
Sir, I am an anterior segment surgeon, sir. I'm not retina.
Okay, okay. Chalo, Lekha, best of luck. Do well.
Thanks, sir.
Dr. Pooja, why the quiz master, Dr. Pooja is her video is off. Tired or time for dinner?
No, sir.
Dr. Meenakshi, कहाँ गए?
So today we
Yes,
have
I'm here.
our 3 LDP members now on the screen.
Yeah, today we have
Dr. Meenakshi Madam, then Jitendra and Dr. Purvasha Naran.
Yeah, Purvasha Narang of the existing batch, and the forthcoming and the next batch we have Dr. Aarti Heda. Good, good.
So 4 LDPNs.
And even I am an LDPN.
फिर तो मैं भी हो गई.
And she is the boss of the LDPs. Chalo, good. So we had a great time. Rajesh, क्या बोलते हो भाई? Busy हो क्या?
No, not at all.
He must be in the
Consistent quiz. I mean, mentors who are always there.
I'm there since
Rajesh
beginning.
and Rajesh sir.
Hoping that at least one of our PG could make it through at least maybe third or fourth.
They will make it. They will make it. Eventually, it is going to be the collated score. I think this was our seventh round. Sixth one. So we have 2 more episodes of preliminary rounds. So
Next will be on
and so next is on the
14th Feb.
14th Feb on Valentine's Day. We are
The
meeting
Valentine's.
quiz masters. Yeah. So now
Jitendra, you are free.
Valentine's खराब कर बच्चों का Valentine's
You
खराब
are
कर
free, na?
we are leaving the people who are unoccupied and people who are married and do not want to go back to the same Valentine again for a while. We are here with you as a quiz master.
नहीं, I think वो जानबूझ के आपने choose किया because Valentine's पे कहीं और नहीं जाना पड़े so that
Come on, we
you
are
occupied.
online. We are online, no issues. Officially beat. So, friends, it's time for us to say goodbye. Well played, all the teams. Next time, we will like to meet you on 14th. I know the attendance is going to be thin, but remember, it is the best of the 5 amongst the 8 preliminary rounds that will be put in together for qualification into the quarterfinal rounds. So, do make an effort. Your Valentine, if it is going to be a long time relation, she's going to wait for you, even if it means 9:15 onwards. So book your Valentine after 9:15 and dinner with her.
Or
Everything.
you can get your Valentine to play the quiz first and then go and have the dinner together.
Yeah. Okay. Okay. Either way, we accept it. So fine, everyone. Thank you. Thanks. My sincere most thanks to all the quizmaster, Dr. Pooja, Aarti, Dr. Meenakshi, Dr. Purvasha, and Bharat for being with us, and the consistent mentors, Dr. Purvasha and Dr. Rajesh, for being with us always, and
It's always a pleasure.
and our hero from Ahmedabad, who is going to host us shortly, Dr. Jitendra. Thank you for being with us.
Thank you, sir.
And
Thank you
of
so
course,
much.
my right and left hand, Dr. Shilpi. She's on the left side today. So for being with me today, we had a ARC hackathon event which was happening simultaneously, so I couldn't come into the initial part of it. But thank you, everyone. So time for us to say bye bye. Let's catch up.
Thank you so much.